I'm Mary Beth Best, an advocate with Voice Incorporated, an independent nonprofit organization helping people better understand their Medicare benefits. The Medicare prescription drug benefit, or Medicare Part D, was added to the Medicare benefit plan in 2003 under the Medicare Modernization Act. Since then, there's been a lot of confusion and misconception about the benefit. It's important to remember there are three major parts to Part D. There's the initial coverage period, the coverage gap, or the infamous donut hole, and the catastrophic benefit. Under the initial coverage period, your prescription plan may or may not have a deductible. The deductible can be no more than $295. Now that figure is a 2009 figure. We may see that change for 2010, but right now the most a deductible can be is $295. After that deductible is met, you have a period of time where you pay about 25% co-insurance on your medications, and your plan pays 75%. Now that could come in a form of a flat copay, but it cannot exceed the 25-75 split. That is up to a $2,700 limit on medication costs. At that point, you have finished the initial coverage period and you enter what's called the coverage gap. During this period, you do have to continue to pay your Medicare premium. However, the cost of the medications for a temporary period of time would come back to you 100%. Until you reach an out-of-pocket cost, and that is an amount that is a true out-of-pocket cost to you of $4,350 in medications. At that time, you would enter what's called the catastrophic benefit, the third part of the Medicare Part D. During this time, you would only be charged at a 5% rate of coinsurance on your medications. For the remainder of that year, 95% of your medicines would be covered. For some, there is extra help for this benefit. If you meet certain income and asset requirements, you could qualify for extra help through Social Security or even your state Medicaid office. There is an annual enrollment period that begins November 15th of every year and ends on December 31st. And this is the time that you can reevaluate your Part D plan. Make sure that it's covering your medicine at the best rate and make sure that you have a plan that works for you. You can search through the Medicare.gov website to make these comparisons every year. This is Mary Beth Best, an advocate with Voice Incorporated.